I think we first heard about a potential vaccination being available in early December, and so part of our work was to plan for delivering a small-scale vaccination programme to our frontline staff. That soon grew to a request to deliver vaccinations to about 10,000 health and social care staff across Herefordshire. And that quickly grew again to delivering the programme not only to 10,000 health and social care staff across Herefordshire, but also to the public. Our initial planning was to use our workforce that we use for the flu programme. So we have 30 peer vaccinators that deliver the flu vaccination each year to our staff. It soon became apparent that the vaccine's very different to the flu vaccine, and therefore how we deliver flu vaccination wasn't going to work. And it soon became apparent that 30 vaccinators wasn't going to be sufficient to deliver a programme at that scale. But I think there was just a real energy from our staff and a willingness to want to get started.
We knew the total population, we knew how many people we had to vaccinate. So finding a site where we could get 10,000 health and social care staff through at the hospital was a challenge at the start. And that's why we've resorted to a marquee, which is affectionately known as the tea tent, and has become quite a feature of our vaccination programme.
At the point we were planning for the vaccination programme here at Hereford, it was probably at a time that the hospital was at its busiest with COVID patients, and the vaccination was a ticket for all of us and one step in the right direction to get out of this pandemic and get back to some form of normality. And I think that's why there was such enthusiasm from all the teams that were working on pulling this together, because we recognised that this was a step to protecting our patients, protecting ourselves, but keeping our staff at work so that we could care for patients at a time when we were really very busy.
The challenge was getting the right amount of people matched to the right amount of vaccine that we had available and within the limitations of its storage and handling, with the right amount of vaccinators and staff to facilitate, to deliver it.
I think part of being involved in the programme personally is not only working with colleagues who I wouldn't ordinarily work with on a day-to-day basis, but it's just how thankful the public have been and how vaccinating individuals who actually, some of them hadn't left their homes in over a year. And so for them it was a massive step to come out of their houses to receive the vaccination.
As a county, we were very successful in getting those numbers through, and that was both based on the sites but also our working together, our relationships, in that we worked with primary care colleagues to provide them with people and vice versa.
I'd really like to thank our pharmacy colleagues, logistics and administration services, allied health professionals, nurses and pharmacists, all of our volunteers. And I'd also like to thank partners in other organisations who've been critical in pulling this together across the whole of Herefordshire.
Notwithstanding the whole programme, I take a great deal of delight in our achievement that with 40,000 doses administered so far, Wye Valley Trust haven't wasted a drop.